We are wrapping up our week-long series on women's health issues here on Good Morning Jacksonville. We've discussed various forms of physical illnesses, but this morning we take a look at one that is not physical, it's mental. According to the group Mental Health America, depressive disorders affect approximately 19 million American adults. Of those, 30% are women. That same study found 4 out of 10 women were too embarrassed to seek help. Joining me now is Dr. Rebecca Arenas, the psychiatrist with Baptist Health. She joins us now with a little bit more information about depression, and it's interesting about the women not wanting to come forward. By the way, thank you for joining us this morning.
You're very welcome.
Women not coming forward, maybe a little apprehensive to come forward to talk about depression. Why do you think that's the case?
I think there are lots of reasons why women are reluctant to seek help for depression and many other illnesses. I think one of the biggest reasons can often be time, not having the time to take care of themselves because they're so busy with work and family and other obligations that they have in life. I think also people worry that others have more problems than they do, so that seeking out help for depression, you know, can look like they're whining or not grateful for the blessings that they have in their lives.
Right. Now, we were talking earlier, and you said about 50% of your practice is handling folks who are treating folks who have depression.
Correct.
Are you seeing more folks coming in with depressive symptoms because of, say, the economy?
I think that has a lot to do with it. I don't know that I'm necessarily seeing more patients come in because of the economy, but I think that the economy is verbalized as a stressor more frequently these days than I have seen in the past with my patients.
Is it the depression does it build up over a number of years and then someone has to seek help, or is it more of a situational type of thing?
It can be both. There are some people who succumb to stressors that do build up over time, and eventually they just can't handle it anymore. Yeah. Or maybe someone in their life that matters to them says, look, I really am concerned about you, and it's time that we seek help. And then there are times when there's just one massive situational stressor that causes such extreme distress that they do choose to make that move to seek out professional help. You
know, a lot of folks have priorities in their lives, and I think you're kind of taught to have priorities, right? But
sure.
Sometimes that, I mean, is a bad thing, and it could lead to depression.
Definitely, and I think especially for so many women, the pressure to perform at work versus the pressure to be super mom and take care of your family members the way you want, those pressures add up, and that can lead to symptoms of depression over time.
It's really the balance, isn't it? It always kind of comes down to that, doesn't it?
Absolutely, yes.
All right, Dr. Fernandez, thanks so much for joining us this morning. By the way, we have all our stories from Women's Health Week in the health section of firstcoastnews.com. You could go ahead and check out any of the stories that we have over the last 5 days. Thanks again, Doctor.
You're welcome. Thank you.
Let's go over to Michelle, see how things are shaping up weather-wise today. And traffic first, though, because